needs of medical supplies for tertiary level hospitals, second level hospitals. So health center kits primarily address health centers as the nomenclature goes. Number 4, the commitment to complete spending health infrastructure projects. In reference here is mini hospitals as well as maternity annexes. The pronouncement also to construct maternity annexes. Now, we may all be aware that the infant mortality rate in this country as well as the maternal mortality rate still remains high, and it's one of the strategic objectives in the National Health Strategic Plan. We believe that this pronouncement is a welcome one, and it will help cushion or reduce the MMR, which is maternal mortality rate in this country. Now, before I go to the noteworthy pronouncements as highlighted in our submission, I just want to make reference to the budget plan for Ministry of Health, which focuses on strengthening public health, increasing access to quality health care, increasing participation of non-state actors in healthcare delivery, such as private providers. The reason I'm highlighting this is that given the table that we just referenced, Madam Chairperson, these goals or these strategic objectives cannot be met without ensuring that we strengthen these 4 system blocks that I was just referencing. Human capital for health is critical to ensuring that every person that visits a health facility is met by a qualified health personnel. That is why I'm actually referencing these as submitted in the budget head 46. Further to that, in order to ensure that services are brought as close to the people as possible, the ministry proposes in its strategy that the functions would be decentralized and devolved to the local authorities. We welcome that move as Zambia Medical Association, because we believe if decision making is decentralized to the local authorities, it will allow for decisions that speak to the needs of the respective communities, and it will inform national planning based on those service needs. Further to this, there's another strategy which was proposed, which is equipping health facilities, which shall be prioritized. Now, from our understanding as Medical Association, when you reference equipping health facilities, we understand this includes staff as well as equipment. Now, coming to the budget allocations on equipment as outlined in the budget submission, we did note that despite this strategic commitment, there's a reduction, or the proposed estimate for 2024, there's a reduction on the allocation to procurement of equipment, which we thought as Zambia Medical Association would have been prioritized, and a higher allocation would have been made to that effect to ensure that equipment for facilities is made available. I'll reference, or I'll take maternal mortality as an example. Not all facilities during antenatal do provide ultrasound services, and we believe this is critical equipment that should be procured. And on that note, we felt as Zambia Medical Association that the allocation to procurement of equipment would have been a bit higher. As per your request, Madam Chairperson, we were also requested to comment on the Ministry of Community Development and Social Services. In there, we do note that the government has made commendable strides in providing, firstly, free education to the community. It has also made strides in ensuring that the strides in the agricultural sector, which will help alleviate the poverty in this country, as well as the nutritional basket for individuals in the country to be made improved. Now, the reason I'm talking about the agricultural interventions that were pronounced by the minister, though not directly related, it is incidental in that when the nutritional basket is poor, you will see a surge, as is already evident in the remote areas, a surge in malnutrition cases, particularly referencing to undernutrition. In the line of rail, this might be overnutrition, but in the remotest of places, we are noticing situations of undernutrition, and undernutrition impedes the body's immunity to respond to any external let me say bacteria or external sorry, I beg your pardon. It impedes the body's ability to fight off infection or diseases. So, and that does impact our ability to provide proper services and gain the desired outcomes when we are treating our patients. In the budget, further, it was proposed that primary health care services will be enhanced, hospital services will be enhanced, central tech services will be enhanced, as well as human resource development. Now, to comment on this as the Zambia Medical Association, Madam Chairperson, I did mention that for us to achieve universal health coverage, to also ensure that our people receive high quality of care, or high standards of care, they need skilled human resource, not only at entry level, but at specialist level. Now, looking at these programs, we did note that in the budget submission, the component of resources that has been allocated to training, that is both in-service and pre-service, has been reduced. Now, this contradicts the strategic plan for health, which proposes to, by the end of 2026, to attain a number of over 700 specialized personnel providing services. So it is in our view as Zambia Medical Association that this be looked at, and to ensure that adequate numbers of health personnel are budgeted for and trained during the 2024 financial year. I would also want to put it on record that according to the budget submission, only 50 personnel have been planned for, which is for us as Zambia Medical Association, we are cognizant of the limited resource basket, but we believe that as we try to make strides towards universal health coverage, training and developing human resource should be critical to the policy makers. I draw your attention to the next section, which is noteworthy pronouncements of the budget, which we welcomed as Zambia Medical Association. The association further notes and welcomes the following pronouncement: direct or indirect, direct or incidental to the health as well as social sectors in the 2024 budget. Number one pronouncement: the establishment of local pharmaceuticals and manufacturing strategy to promote domestic production of medicines and medical supplies. We applaud this pronouncement, and we encourage or urge government to expedite the development of this strategy. Regarding policy and legislation, which was proposing the review of Public Procurement Act of 2020, as Zambia Medical Association, we strongly believe that this has the potential to eliminate rigidities surrounding procurement processes, not only other sectors, but including the health sector as well. We welcome the pronouncement that recognizes that health has ability actually to provide revenue, domestic revenue for this country, and that is by enhancing health tourism. Number four, construction of the cancer treatment centers, which is decentralizing service from the single cancer disease hospital which we have in Lusaka, by constructing one in Livingstone as well as one in Ndola. This will bring cancer services as close to the people as possible, Madam Chairperson. We welcome the introduction of funding towards electronic health record system. This will not only improve efficiency, but provide quality data of diseases, disease surveillance, and help in decision making, as well as resource allocation. I must add to this submission, Madam Chairperson, that health data for far too long has been a challenge, and data is critical to making decisions as well as planning, and with the introduction of the electronic health records, which I believe also borders on digital health transition, will enhance the quality of data that we work with. It will also enhance our research capabilities as a country, because as a sector or as the medical practitioners, we rely on evidence-based medicine, and our decisions usually are backed by science. So we welcome this move. Number 6, it's the improved rural connectivity project. This talks about infrastructure, road infrastructure. It was not directly under the Ministry of Health, but it is incidental in that for far too long, Madam Chairperson, our people, the citizens of this country have faced challenges in terms of referrals. When patients are referred from one rural health facility to the next level of care, they have to traverse bad roads, and this reduces on the referral time, or increases the referral time rather, and also hampers the timely intervention that may be required. I'll give an example of a mother who is in an active phase of labor, and for some reason that health facility does not have the required healthcare practitioner to deliver that pregnant mother, and requires that they be referred to the next health facility. Now, if the roads are impassable, the roads are in a deplorable state, you can imagine the scenario. This is where we end up with bad maternal outcomes, bad fetal infant or fetal outcomes. So we welcome this pronouncement, and we encourage the government to expedite the works on the rural connectivity project. We welcome pronouncement number 7, which is efforts to improve food security and ultimately the nutritional baskets of the country, as this will help combat the rising cases of I did allude to this. We also noted, Madam Chairperson, that the government has made deliberate effort. In the past 3 years, there hasn't been allocation to mental health services, but in this budget, the estimate shows that there's allocation, an amount that has been allocated to the mental health services. It is welcome, and this is a rising disease burden in the country. So we believe that this allocation will help cushion the fight against mental health. I come to the section which we labeled earlier, areas of improvement, analysis and areas of improvement. Now, despite the above pronouncements, Madam Chairperson, and the positive trajectory based on the financial allocation to the sector, the Zambia Medical Association is concerned. So number 1, it's on the financial allocation, which I did mention. It still falls below the Abuja recommendation. We are 15%. We are at 11.8%. The second one is the rate of absorption of skilled healthcare workers into the civil service is lower than the production rate. This is not just for medical doctors. This is across the healthcare basket. So we have a higher rate of production, but the rate at which these colleagues of ours are being put to service is lower than that. So I'll give an example. In the National Health Strategic Plan, the projection is that by 2026, and I'll reference one cadre, medical doctor. The bias is obvious, I'm a medical doctor. I'll reference the medical doctor. The projection is that by 2026, the government plans to recruit 2,100 medical doctors. Now, if we divide that figure as illustrated in the table on the next page, you will discover that we are planning for close to 420 medical doctors to be recruited every year until 2026. Now, estimate production rate is over 800. That is locally trained health personnel. That excludes those who are trained outside. Now, with over 800 and we are recruiting 420 per year, we have a deficit or a balance of 380. We multiply that by 5, we are looking at 1,900 medical doctors that will not be working, but they will be qualified, they will not be providing active service. This, and at present as I speak to you, members of this committee, we have 1,027 medical doctors that are awaiting recruitment. They are qualified, they are ready to serve the Zambian people, but they are still waiting. This also goes probably for my other colleagues in the other disciplines, which is nurses, nutritionists, optometrists, pharmacists. So as an association, Madam Chairperson, our submission really, as I will reference to the recommendations, you will see that there is need to allocate more resources towards human capital recruitment. Coming to point C, our note of concern is that we equally have a high neonatal mortality rate, despite me mentioning referencing the maternal mortality rate in the country. Neonatal mortality rate stands at approximately 25 deaths per 1,000 live births, against a set target of 12,000 per 1,000 live births by 2030. Now, when I was reviewing, or when we were reviewing this budget, Madam Chairperson, we didn't see a specific budget line that addresses that issue. So it would have been a welcome move to specifically address this issue. Then, coming to the next submission, despite the budget's emphasis on private sector-driven economic growth, economic-driven growth model, there is lack of consideration of the health sector as a potential sector for job creation. Why do we say this as Zambia Medical Association? For a long time, Madam Chairperson, other sectors have received direct injection of resources, loans, and various, they have had access to resources that enable them to start up CMEs and other different business avenues. The health sector equally has that potential to drive job creation in this country, if only resources would be allocated in a similar fashion. The supply of health center kits, though this is helpful, I did mention earlier that the association is concerned and urges the government to, I'll just paraphrase that, Madam Chairperson. The supply of health center kits, though helpful in cushioning the stockhouse, requires a long-term solution. Given that some health center kits, they lack what we call tracer products, others reference them as essential commodities. I think 2 months ago we received submission from one of our members that some of the health center kits did not have anti-malarials. We are all aware as a committee here, as well as a nation, that malaria still remains a major disease burden and a contributor to mortality in this country. So we would like to see a situation where we go towards a more long-term solution, which is in this case, as proposed in the budget, the hybrid model, which proposes both health center kits for the health center facilities as well as bulk purchase for higher facilities. Then national health research. Here it's a critical component in terms of health service delivery as well as decision making, and this area requires adequate attention. Madam Chairperson, healthcare worker staff debt. We've noted in the budget there has been submissions or estimates that are allocated to personal emoluments, and then it also highlights that others are allocated to other emoluments. We haven't seen a direct or deliberate allocation towards health staff debt dismantling. So we would have loved to see that. We are aware that there is a budgetary provision for dismantling of local debt, and we would love to see that healthcare sector is given priority, ensuring that that debt is dismantled. The pronouncement of increasing the constituency development fund is welcome. However, it remains unclear whether part of these resources can actually be used towards a critical sector like health to address local needs of particular constituencies. So there's no specific mention of that in the budget, and we would have loved to see something of that sort. With the rise in deaths due to road traffic accidents, specific considerations in improving ambulance as well as evacuation services would have been welcome, Madam Chairperson. We haven't seen any alludement to that, so it is something that raised concern from the association. At this point, I would like to proceed to our recommendations as an association. The association, Madam Chairperson, acknowledges the limited fiscal capacity or resource envelope and is cognizant to the fact that not all challenges will be addressed in one instance. Notwithstanding the limitations, the Zambia Medical Association makes the following recommendations. Now, these recommendations are emanating from the submission, the analysis, as well as the review that I just presented, and it will be segmented in line with system blocks. That is on human resource for health, that is human capital for health. I did mention, Madam Chairperson, that on the training component, we have only noted 50 that have been budgeted for in the 2024 budget. That is both in-service and pre-service training. We would have loved a higher number of health personnel to be considered for training and budgeted for in the 2024 budget. The budget line for healthcare worker recruitment should correspond to existing needs. This is our submission, Madam Chairperson. We've noted a number of pronouncements of construction of mini hospitals, construction of completion of maternity annexes, but we haven't really seen whether this has factored in the human capital need. What we don't want to see is a situation where facilities are built, but there is no staff to work or provide services in those centers. Such is happening at present, Madam Chairperson, and this is why we have kept on emphasizing the need to increase the allocation towards recruitment of health staff. We appreciate the 4,000, but we believe the government would have done more by increasing that allocation. Diversifying. The second one, we submit that consideration to diversify the employer base by encouraging private sector participation in health should be considered. This can be attained through a deliberate allocation of zero to low interest loans to the healthcare professionals that are willing to venture into establishing private practice or communities of practice, Madam Chairperson. This will free up positions within the government establishment and act as an alternative employer, as well as increase access to health services. I will dwell more on that point, Madam Chairperson. It is our view as Zambia Medical Association and as professionals that if resources are provided, deliberate resources are provided to the sector, formation of probably cooperatives, what we are referencing here as communities of practice, it would allow us to establish, be it clinics or district level hospitals, which will not only employ junior doctors, senior doctors as well, and also provide employment capabilities for nurses, be it nutritionists. So this is our appeal as Zambia and submission that if this deliberate policy could be provided, it will be a welcome move and it will help cushion the pressure on government to recruit all the healthcare professionals that are being produced in our universities as well as abroad. We also submit that allocate more resources to the promotion and recruitment of healthcare workers and suspend the termination of contracts for performing healthcare workers. This will prevent having ready infrastructures but with no workers and ensure continued availability of services, service providers rather, especially in the underserved communities. In the strategic plan, Madam Chairperson, it is government's plan that a minimum, every health facility should have a minimum of one qualified healthcare provider. And this is critical in that over the years we've noted that sometimes when our people go to these facilities, they are attended to by people who do not even have any certification in the health training programs. That is a hazard, and we believe by increasing this, by promoting, recruiting, we will ensure that we have adequate personnel. The current report in the budget as well as the analysis that was submitted, it does show that government has met this target for the 100 and projects that in 2024 they will maintain access by 100% and ensuring that each health facility has at least one qualified person. As Zambia Medical Association, we would propose that this be scaled up, not just one, but two, and specification be made on which cadre this person is likely to be. I would love that, Madam Chairperson, because healthcare cadres are different and their scope of practice as well as the scope of service that they can provide differs based on their qualification and level of training. Coming to submissions and recommendations under medicines and medical supplies, we do acknowledge the budgetary allocation to towards this, and we welcome it. And we recommend that government makes efforts to unlock all rigidities that have played a role in delaying procurement of medicines and medical supplies under the Zambia Medicines and Medical Supplies Agency. Ensure timely ordering of drugs and other health products. I beg your pardon, in my submission, the document before you, there's an error there. It says order, so it should read other health products to prevent a stock out. Madam Chairperson, timely procurement reduces the stockouts and shortages, and it will ensure that our patients receive services in the facilities without need to go and source medications elsewhere, which must or would otherwise have been provided if procurement was done on time. The association further recommends to strengthen the stock monitoring and inventory systems to avoid wastage and late detection of lost stocks. By wastage here, Madam Chairperson, there have been instances where drugs are nearing expiration and then they are offloaded to facilities. We do not want such instances because drugs end up expiring without having reached the needy patient. Strengthen security and transportation logistics for commodities. This is something we would have loved to see in the budget, allocated resources for security towards when these shipments are being made to various remote destinations. There must be security to ensure that they reach the intended population or the intended people. Revision of health center kits, as well as expedite the establishment of the local pharmaceutical and manufacturing strategy to promote domestic production of medicines and medical supplies. And the last recommendation under medicine and medical supply is to expedite the review of the Public Procurement Act to include provision for health products. The third recommendation is under the financial allocation. The 11.8% is welcome. We, however, hope to see more in terms of meeting the recommended 15%, the Abuja recommendation of the total national budget. We further recommend under this that these resources be remitted to the ministry responsible for health in time, as well as the reason we did put this recommendation is that, Madam Chairperson, there was a pronouncement that 3,000 healthcare workers will be recruited in 2023. There's also a pronouncement that 4,000 will be recruited in 2024. Now, the 2023 recruitment, Treasury Authority was only granted last month, if my memory serves me well. So this recruitment is still ongoing. And we are almost at the end of the financial year. So our recommendation on that end, that was the basis for recommending that these resources be granted on time, and if possible, the 2024 recruitment be effected in the either first quarter or at least the second quarter to ensure that we meet the objectives as laid out in the budget estimates and outputs per program under health. We also recommend consideration be made for the utilization of CDF resources for this critical social sector, as this will cushion the already obvious budget deficit. There is need for a clear budget line within CDF that at least allocates resources for health-related projects, including what we are talking about, such as financing cooperatives or communities of practice that of health professionals or any other individual that would want to establish a health facility. Coming to universal health coverage, we did note, Madam Chairperson, after reviewing the entire budget, we could not identify any syntax earmarked for health. and we would have loved to see that. And these resources could, if the government wishes, be directly channeled towards health. This is a practice in other regions, and it has at least assisted, or studies have shown that it has assisted towards in the strides towards universal health coverage attainment, as financing is a very critical component of the universal health coverage agenda. At present, Madam Chairperson, the National Health Insurance Management Authority is struggling. It is in the papers due to finance all the demands that are coming through. And this is majorly due to demand for services by non-paying members. And that is above those who are aged above 65. That is why we feel that if measures or policies that look at other sources of revenue in proposal that we made, the syntax, could be directed towards the health sector or the National Insurance Management Authority to cushion that pool of patients that need services but do not actually contribute to the resource pool of NIMA. On health infrastructure and equipment, the association proposes or recommends prioritization of procuring equipment, especially critical equipment that has been non-functional for a long time. The allocation to this, I did mention, Madam Chairperson, that the budget shows a reduction for the 2024 budget. So we would have loved it to have been the opposite. Prioritize the construction of maternity annexes. The basis for this is obvious. Maternal mortality remains very high, and we would love to see that we reduce it to the desired target as proposed in the National Health Strategic Plan. Consider tax rebates on certain medical equipments. Now, this will allow people who want to import equipment or purchase it locally to procure this equipment and provide the much needed services. Oftentimes, we do note that due to lack of this equipment, we end up outsourcing services to the private providers. So we would love to see that, or to have seen that in the budget, that consideration. On medical tourism, the health sector holds immense potential to contribute to the foreign revenue pool through medical tourism. This is already evident by the surge in numbers of patients from across the border seeking health services in the country. We have a number of our colleagues across the border who are coming to seek services in this country. And this is potential in itself to generate resources for this country and cushion the deficit that may be evident. ZMA therefore recommends that a deliberate enabling policies be considered and extended to the sector for local capacity building. Some of the experimental economic models being proposed within the M phases can be extended to the health sector as well. So here we're looking at reduction in certain taxes and primarily tax rebates. So if I want to import special equipment from abroad, it could be exempted, or certain waivers could be provided to allow that equipment to come in this country. And this will reduce on the need for us to actually refer patients for treatment abroad, which is costing the government. In the current budget, we've noted that this has been allocated a 30 million kwacha for the year 2024. Staff motivation, Madam Chairperson, I cannot belabor on this point. It's a critical component. The sector that we are talking about, particularly health, is very crucial, and the environment in which healthcare workers operate is one that requires them to be highly motivated. And to achieve this, Madam Chairperson, the association is recommending the following: a percentage from within the allocated budget line for dismantling local debt be earmarked for health staff. I did mention, Madam Chairperson, that the health sector debt still remains largely unattended to. So we would love to see that this begins to be worked on. This will motivate not just doctors, but everyone across the health sector. Considerable revision of wages be considered. The cost of living, Madam Chairperson, has gone up. this also affects healthcare workers. I know there's a common saying that it's a calling, but we face the similar challenges as any other person out there. So we would love to see that attended to, Madam Chairperson. In conclusion, Madam Chairperson, I would like to say the Zambia Medical Association remains committed to working with your office and the government in advancing the developmental agenda of this country, and we also remain steadfast to our vision and role as a critical stakeholder in the health sector. Thank you for engaging us, and this is our submission as Zambia Medical Association. Thank you.
Wow. Thank you very much, Doc, for the good presentation. We are now going to have questions from our honorable members. If there's anyone who would like to ask a question, please. We'll start with Dr. Katakwe, then Honorable Kankoyo, Musanje. You'll be the third one? Yes. All right. We'll go in that line.
Thank you, Chair, and thank you, Doc, for that wonderful, elaborate presentation. I'm Honorable Dr. Katakwe Alex, Member of Parliament for Solwezi East constituency. You've stated in your presentation about the breakdown of equipment in the hospitals, and also you've talked about the 11.8% allocation as opposed to the recommended 15. But then my concern is, if you look at the previous budgets, the absorption rate in the Ministry of Health, you find that at the end of that fiscal year, not all funds would have been utilized. Okay. The funds will remain, but yet you have got all those needs, critical needs, like equipment, recruitment, and other things. So what is your comment? Should we continue to strive to attend to the 15% budget declaration, the recommendation, where we are failing to absorb all the monies that is allocated? So I just want your comment on that. Thank you, Chair.
Okay. Marita.
Thank you. Yes, Chair, I think I've got a couple of questions, but I think I'll go two whenever given an opportunity. The first question is on their submission that diversifying the employer base by encouraging private sector participation in the health. This can be attained through the deliberate allocation of zero to low interest loan to health professionals willing to venture into established private practice or community of practice. Are you aware that under the CDF there is a loan component where each constituency is given an average of 3 million kwacha every year, and the cooperatives, maybe companies, can apply for a loan for 200,000 kwacha to be paid in 48 months at an interest rate of only 10% per year. So if maybe your members were able to take advantage of that window, it would also help them maybe expand, build an extra room, buy an equipment. Those already who owns the private hospitals can recruit more people to provide that. Then the second one obviously comes to consider utilizing CDF resource for critical sectors such as this will cushion already obvious deficit. This need for a clear budget line within the CDF. So through the CDF, are you aware that there was a pronouncement which becomes government policy that each clinic should have a maternity wing? And we are doing that because that comes when the president pronounces, we have to follow what he says. So that is already the direction to say all clinics should have at least a maternity wing. Each clinic should have piped water, so we sink boreholes powered with the solar panels in all the clinics. The buying of equipment to increase rural connectivity. We grade roads towards to ensure that all roads leading to clinics and health facilities are in a good condition to reduce the time it takes to take a patient to a clinic, plus also the risk of a pregnant woman traveling a bad road when they're going for maternity services. So those are some of the interventions already in the CDF which are being done towards the health. So when you say there's need for clear budget line, I don't know, beyond what we are doing, what else would you expect? Thank you.
Okay, the last one.
Thank you so much, Doc. Very elaborate and wonderful presentation. I just wanted you to amplify on the health domestic debt. I think you have emphasized it, but it's not clear where it's coming from for us to be able to maybe pick it up properly.
Okay, it's your time, Doc. You can answer those questions.
Sorry, Honorables, I may not address you directly by your names. I didn't take note of that. Honorable Hudson Maveta. All right, thank you.
Honorable Munsanje.
Honorable Munsanje. Thank you so much.
Doc, you know him because he's your fellow, he's doctor. Dr. Kataku.
No, I did take note because he did introduce himself before making the question.
Okay.
Yes, so I did take note here. Thank you. Doctor, thank you for the questions, and I'll try as much as possible to respond, pay information that is available to us. Madam Chairperson and Dr. Katakwe, the burn rate of resources allocated to the ministry. I think when resources are allocated, it is imperative that the controlling officers ensure that the resources are directed towards the intended purpose. Now, if according to your question, we are having resources being retained or without being fully utilized, then it is incumbent upon the ministry responsible to ensure that going forward, and we would love to see that as Zambia Medical Center, that those resources, if they are indeed remitted on time, they are allocated. If in this case, I'll just take maternity annexes as an example. If there's a plan that we are going to build 30 maternity annexes and resources come in November, close to of the financial year, I don't think you expect those to be completed, and the remainder of the resources will have to be retained. That is why in my submission I did make that these resources need to be delivered to the responsible ministry in time, so that even the controlling officer in that ministry will be able to allocate those resources for their intended purpose. Yeah, but if anything other, if they are indeed being remitted on time, then it is an issue of strengthening the systems within the administration of the institution. Thank you. Honorable Hudson, 3 million. I think in my submission, if I reference to my document, if you go to the section which says noteworthy pronouncements, we did as Zambia Medical Association welcome firstly the increase in CDF allocation to the provinces. What we didn't note is that what we wanted is a clear policy or provision within the guidelines for the utilization of CDF that specifically allocates a certain portion and says this is for health cooperatives. But as it is, the 3 million stands, it's open to anyone. So if prioritization, and we did write in our submission that priority could be given to this critical sector. The 3 million you are referencing talks about the broader loan package. It has no specific specification that this, let's say maybe 30% of this 3 million, you reserve it for health-related interventions in each constituency. And we do acknowledge the government's efforts in creating those maternity annexes, including mini hospitals. It is on record that they were completed, some of them using CDF. Coming to the road networks, I did, among the noteworthy pronouncements, did mention that as an association, we acknowledge and encourage government to expedite the improved rural connectivity project which they are undertaking, which I did reference and say this will reduce the referral time as well as the intervention, also provide us with ample time to intervene in any case that is being referred between institutions. So from our end as an association, what we are specifically requesting for is a dedicated portion of that loan component to be earmarked for the health sector. Thank you. Honorable Honorable Musanje, amplification on the health local staff debt, and particularly for health staff. I think I will not go into details discussing other professionals in the sector, but I'll give you an example for the medical profession. As of 2022, the staff debt in terms of personal emoluments, arrears, settling in allowances, as well as gratuities, were amounting to above close to over 200 million kwacha. And this is something that has remained. I can tell you for a fact, and go on, since I'm on record, Madam Chairperson, there are some members of our association that have never received gratuity from the time they started working on contract. And this is why we are saying they remain demotivated, and would love to see that this at least is given some attention, so that these people begin to receive their benefits. They have been serving this country tirelessly. COVID-19 pandemic did come, and it hit us hard, not only the health sector, but we suffered casualties. But these people still stood with the country. And Honorable Musanje, it's one area that has really touched our members, and we would love to see that attention is given to that. And we do acknowledge the government's commitment in that they have given a specific portion to dismantling local debt. What we want to see as Zambia Medical Association for the whole sector is that priority be given to addressing this debt as well, even as other sectors are being addressed. Thank you.
Doc, how often do you receive your gratuity?
Madam Chairperson, I'm not a contract employee. I'm a permanent and pensionable employee, and this basically references my colleagues in who are on contract, and that is on an annual basis at the end of the contract, which is 3 years. Yes.
Okay, they are the ones I was asking about.
All right. Thank you.
Thank you.
Dr. Shinkuri, thank you so much, Chair. Doctor, thank you for your presentation. I've got a number of issues that I would need your help. To start with, if you look at your presentation on conclusion and recommendations, which is number 1C, where you're saying allocate more resources to the promotion and recruitment of health care workers, and suspend the termination. That is where actually my focus is. And suspend the termination of contracts for performing. So I think I would want to, it's like this also no delays into health delivery in the system. I would want you to talk more on this one. Then the second one, I would want also you to amplify on the bottlenecks that are looking at recommendation number 2, medicines and medical supplies, and local rigidities that have delayed the procurement of. Maybe if you can mention 1 or 2 of them, so that we know that this actually hinders in the performance of the Minister of Health. The third one is, how often do you interface with the Minister of Health, if at all you do? So I just want to then think thereafter. I'll have a follow-up question. Thank you.
Members, let's be fast because the other witness is outside. When we continue asking a lot of questions, then we are going to delay the other witnesses outside. Okay?
Okay. Thank you very much. Just 2 observations from your presentation again. You've talked about to unlock all rigidities that have delayed the procurement of supplies by ZAMSA. Would you just be categoric in terms of some of the critical rigidities that may help this House to make follow-up with regard to the procurement, the delayed procurement? And the other where you stated national health research, which is critical in terms of health, and you mentioned about promoting traditional medicine in this regard vis-a-vis the research aspect. As a medical association, do you have any engagement with what has been outstanding for a long time? That is the sondage formula. I know it is still seated at TDRC there, requiring only about 5 million to have the other phase of trial. What are you doing in that area if we have to strengthen and promote traditional medicine in this research? Thank you.
Okay, Honorable Maveta.
It's the last two. Yes, you talked about certain essential medicine like anti-malaria missing in the health kits, health center kits. And a simple understanding I have about the health centers is obviously it's a box set with 58 different medicines which are sent across the country. These health kits, they take about 6 months to order them. So what I'm trying to say is, if you are going to add anti-malaria to these health center kits, are we not doing a risk where we send malaria drugs to a region like Southern Province where there's very low malaria? We really need good quantities of malaria drugs. And maybe in the time the malaria drug, the health kits come, keep on sending the same quantity of health kits across to the regions where there are very low malaria drugs, or the seasons has been overtaken by the medication. We end up having too much medication which is not being consumed, hence it expires. So then the second question is on the clear program on the equipment needed in these health centers. Would you be in a position, given a chance, be able to submit to this committee clearly the basic equipment needed in each health center? If it says in the maternity wing, what are the basic equipments needed? Because I've seen when I go to a clinic, you find the scale is off, even just a simple machine for BP, it is as old as 20 years. So I seem to be grappling with this expansion of building more and more clinics, more maternity, and we're going to face a situation where I've got too many buildings without equipment. So are you able to provide or going to guide the simple basic equipment needed to be stocked every time at each health center or clinic for people to get a good service? You go to a maternity service, there is no ultrasound. So how do you determine the growth of the child in the womb? Thank you.
Thank you, Honorables. Let's minimize the questions. I know, but the witness is already outside. Okay, Honorable Msanji.
Thank you so much again, Doc. Is it possible for you to, you've made a number of, your presentation is very good analysis, acknowledges the good things and the areas of improvement, but then your recommendations are quite a lot. Are you able to prioritize what could be your priority areas of work for year 1, year 2, year 3 of the new Dawn government, so that His Excellency can be, and the Cabinet can be able to take the most important and crucial aspects for the next, for these remaining 3 years of action? That way, then you'll be also becoming methodical, than just giving a blanket excellent recommendations. But if they are not timed properly, then we will not achieve what we are looking for. So can you prioritize them to what is it that you want to see this year in 2024, next year 2024, what you want to see in 2025, 26, and the rest can come after. Thank you so much.
Okay. Doc, it's now time to answer these questions.
I stand to be corrected. That is Honorable Chinkole. Chinkuli. All right. Thank you. So, thank you, Madam Chairperson. Honorable Chinkuli, your question borders on what are the bottlenecks, which I believe is similar to Dr. Kataku's question. I think one area that we did submit was in relation to the Public Procurement Act. In its current state, I think it has a number of non-enabling clauses, and we were informed that if the House may guide, that there's a revision to that effect, and we've seen in the budget it has actually been acknowledged as one of the pieces of legislation that has to be reviewed. So that is one of the submissions that we'll make on the rigidities. I submit on that one. Then you referenced the suspension of termination of contract for performing healthcare workers. Honorable, this is currently happening, and it's mostly affecting our non-Zambian doctors. On record, I can tell you that 2 days ago, I received another call from a member of the profession that was just lamenting that their contract had been terminated. Now, these are people who have mostly served in underserved communities, the remotest of places in this country. And if you look at the submissions they make when they are requesting the association's intervention, you look at their performance appraisal, they are above average. So what we are wondering as an association is that why should we begin terminating contracts of these individuals if they are indeed performing above average, serving the needy populations, where the number of doctors still remains very low, and we are well aware that majority of the doctors or healthcare providers are along the line of rail, but outside there, where most of these are serving, whose contracts are being terminated, very few doctors or our local doctors want to go there. So what we want, or what we are asking is that, or recommending is that this suspension be on those that are not performing, those that are not meeting the performance targets as outlined in the performance appraisal document. Then that would be justifiable basis to terminate those contracts. That is our submission as an association. Honorable Hudson, malaria medication missing in the health center kits. I think going back to my submission, I did mention that we acknowledge the health center kits as a short-term solution to the drug stockouts, and I did mention that we are proposing that a long-term, and in the budget we acknowledge the Minister of Finance did mention that the government in 2024 will adopt a hybrid model, which is both the health center kits as well as the bulk purchase. Now, the absence of anti-malarials is just one example. And that is the basis why we are saying this is a short-term solution, because it does not cover the essential or the full package of essential medications that is supposed to be provided to a health facility. Of course, anti-malarials being one of them. Can we submit a list of essential equipment? Yes, we can as an association, and if the committee deems it fit, we can work on this in collaboration, of course, with the Ministry of Health to ensure that we provide that list. And indeed, your observations in health facilities, you find that the BP cuff is not working, you find that some scales are outdated or they are basically not functioning. These are some of the challenges that the healthcare workers are faced with when providing, I apologize for that, are faced with when providing services. A pregnant woman comes, you can't measure the BP. It's not for every facility, but some facilities do have these challenges. And those are some of the things we could divert resources to, other than just focusing on constructing mini hospitals and many other facilities that have been referenced to. Honorable Musanje, priority areas for the year 2024. We could itemize. I don't know if you want us to do that now, or you would want this in another submission that we could forward as extracting from these recommendations. and give you items, maybe 1 up to 5 of these. We want them done in 2024. But key of these, I will tell you, human resource recruitment is number one. Promotions of our long-serving doctors who have been sitting on wrong positions for a long time while they are consultants, but they are getting a salary of JRMO. I must also put it on record here that indeed the Ministry of Health, through our interaction, did acknowledge this misnomer and has made efforts. And in this current recruitment, I can report to the House here that the positions or the recruitment structure has been tailored in such a way that senior positions are going to be created to allow for promotion. So some cadres who have been sitting on wrong positions will now be elevated to senior positions, and then this creates room for absorption of the junior doctors at entry level. However, the association also puts it on record that the number allocated, Honorable, is not adequate. I think of statistics, we've trained 202 specialists under the specialist training program. These specialists, these are fellows of different subspecialties. They are ready to provide service to the Zambian people. But because of the lack of promotional positions or positions for them to sit on, they will still be sitting on junior positions, but they will be expected to provide services at specialist level. So our submission is that promotions be effected come 2024, 2025, 2026. That should be one of the priority areas. Medicines and medical supplies. We cannot function without tools, Madam Chairperson. The medicines and the medical supplies are the tools that we use, just like a carpenter needs their hammer. These are the tools that we need for us to provide the service. Those should be prioritized and stabilized. And we will continue engaging both your offices as well as the Ministry of Health offices, who have been more than welcoming, I must say.
You can submit that. You can submit a revised that has a structured priority list.
I'd asked whether, how often you, if at all, you interface with the Minister of Health. Thank you.
I think this is the last one.
Okay. We do engage as often as necessary, and I must say that we haven't had in situations where they turn us away or do not listen to what we have to submit. So we do engage as often as necessary. I can't put a number to it because sometimes the engagements happen as matters arise. So if something urgent comes up, you will find that we are at the Minister's office or the Permanent Secretary's office to submit our either grievances. Most of the times our profession seems to have been associated with always crying for increments. But this is an issue that has dragged on for a long time. And the nature of our service that we provide calls for adequate attention and ensuring that we are well motivated. Not just doctors, but the entire health sector, or let me say healthcare professionals. So, Honorable, we do engage, and sometimes it's more than maybe as may be deemed necessary, but it's to address arising issues.
Thank you.
Okay.
Honorable Chinkuli. No. Thank you, Doc, for your good submission. We have heard everything, and now we have come to the end of the meeting. But before you go, we are going to remove your immunity, which was conferred on you, so that when you go out there, you'll be on your own. In case of anything, no one is going to protect you. Thank you. Thank you very much.
Thank you.
My name is Honorable Dr. Christopher Kalila, MP, Member of Parliament for Lukulu East, Parliamentary Constituency. Lukulu East is in Western Province, approximately 700 to 750 kilometers westwards, and after Kaoma you go northwestwards. So Lukulu is one constituency and one district. According to the 2022 census of population, it's currently housing more than 96,000 inhabitants in terms of the population, and I must say that it's sparsely populated with roughly about 14 persons per square kilometer. So that's basically about the constituency. Most of the people suffer from chronic poverty, with poverty estimated somewhere around 85